I'm Jacqui Stanford from Continence New Zealand, and we're here with our wonderful continence educator, Janet Thackray. Hello, Janet.
Hello, Jacqui. Good morning to you.
Thank you. And now today we're going to put to you some of our frequently asked questions from carers. And now, of course, the first, very simple, what is incontinence and how do I know if I need support?
Yeah, well, incontinence is a term that describes any accidental or involuntary loss of urine from the bladder or feces or bowel motions from the bowel. It is not normal to be incontinent at all, but sadly a lot of people think it is. Women who've had babies expect to leak. People when they get to the 70s and 80s expect to leak because they're getting older, but it isn't normal. It's very common. 1 in 3 women who've had a baby will leak urine, and 1 in 4 of the general population, that's men, women and children, are incontinent. So we need to find out why, find out the cause and treat it sooner rather than later before that trickle becomes a flood and then you end up with a real problem.
Janet, how can I get help for someone I care for who's struggling with incontinence?
Well, there's lots of help available, but you do have to come forward and ask for it, so please do. A good place to start would be our website, Continence New Zealand. We have lots of information on there for adults and children you can look at. We produce information leaflets, things for caring for people with incontinence or dementia and urinary incontinence, which are very useful for caregivers. You can either just print those off or you can phone me and I can send you out the glossy brochures. You can ring me on the helpline 0800 650 659. This is a free confidential helpline. It's open 9 to 5 Monday to Fridays, and I take calls on Mondays, Tuesdays until 1 o'clock on Wednesdays, and then my colleague Zoe takes over for the rest of the week. So somebody will always be there to take your call and get back to you and give you some help and information. Also see your GP, because it may be something physically wrong that the GP can help with, such as a urinary tract infection, which can cause incontinence but can easily be treated with a course of antibiotics. Or it might be something where you need to go straight to gynecology. You may have a vaginal prolapse, which you may need surgery for. For men, it may be an enlarged prostate, so you may need to go to the urologist because you may need surgery for that. So always see your doctor first, but also ask for a referral to the continence nursing services. We are nurses who specialise in bowel and bladder care and management. They're all over the country. We have a list on our website, so you can look up the one that's nearer to you. All the major centres have them, so you may have an hour to drive if you live out of a major centre, but the whole country is covered, and you can have a look on our website to find the one for you, or you can actually ring them for advice, or you can ask your GP to put a referral through. Now, to see a continence nurse, it is best to see the GP first, because then he will have examined you and done a urine test to make sure you don't have an infection. But any health professional can actually refer. So if you've got the district nurse coming or you're seeing a physiotherapist, they can refer as well. And some take direct self-referrals, and it will tell you on that list whether they do take self-referrals as well, because for some women particularly, if they have a male GP, they don't want to see the doctor and be examined. They're too embarrassed and ashamed, especially older women. So it's really useful if you can do a self-referral so you don't have to do that. But always ask your doctor for a referral anyway, because we can help you manage their incontinence while you're actually waiting for that appointment for the gynecologist or the urologist, because that might take 4 to 6 months. So we can get you started on a bladder retraining program to help. Also, there are continence physiotherapists. There's a list of those on our helpline as well, and they've done extra training in managing pelvic floors, and they deal with men and women. And they can also do bladder retraining, teach you how to do pelvic floor exercises correctly and tailor-make some just for you. So physiotherapists are a really, really good way to get some help as well. So lots of help, but you must come forward and ask for it. Please don't suffer in silence. There's always something we can do. We may not be able to cure you, but we can certainly help you manage it so you can live your life much better and your quality of life is improved.
Janet, what are the options for carers of someone incontinent to be able to leave the house during the day? Do you have any advice here? Because we know this is a really common challenge for carers.
Yes, it is. And sadly, a lot of people won't leave the house because they're so worried about having an accident while they're out, especially if it's a bowel problem. They won't go out. And we call them bladder hermits. They actually become hermits because of the bladder. And that is so sad. People become socially isolated due to the shame and the embarrassment and the stigma. So the thing to do is to plan ahead. Don't go out on spec, always make sure you plan it. So planning and having a structure to stick to will help allay the anxiety, which can in itself cause an overactive bladder and incontinence. So make sure that you wear a suitable pad, one that's big enough to contain the incontinence if you do have an accident while you're out. Take a clean-up kit with you just in case, so some clean underpants, something to clean yourself with, some wipes and a new pad. Make sure you've got that in your handbag. Know where the nearest toilet is to where you're going to be. You can get an app if you've got a mobile phone, and once you go on that, it'll tell you where all the toilets are near to where you are all over the country, and also where all the disability toilets are, because there's not enough of those, and some people won't go out because there isn't a disability toilet near them. So you can look up that as well. And also we have, which is very useful on our website, a can't wait card. This is the actual little card. It's like a credit card and sits in your wallet or your purse. Take this with you when you go out. It's free. You can apply for it on our website, and it says on the card that you've got a medical condition and need to use the toilet quickly. Because with OSH regulations, shops and businesses aren't allowed to let you use the toilet like they used to do years ago. And so this little card, though, can get you through, get you into that toilet. And so that if you are caught short and you can't get to the public toilet, you can make a quick dash into a shop or somewhere. And we've not had anybody declined at all. We've had nobody refuse that I know of, and I'm sure somebody would let us know if they were. Very useful to have that. You might never need it, you might never use it, but it's like insurance. If it's there, you know you've got that option. It can allay that anxiety about finding a toilet. And also, don't go out if you've just taken your diuretics, your water tablets, because most people take those first thing in the morning, and then you're housebound for 4 to 5 hours anyway. But don't take those if you need to go out. Go out, do what you need to do, take your water tablets, your diuretics when you get back home. You can do that. Also, think about mobility equipment. If you have difficulty getting to the toilet because you might have had a stroke or got arthritis, you might need to plan ahead and get a stick, get a walking frame. You may even need a wheelchair for going out. And the malls are pretty good nowadays. They've got wheelchairs to hire, so you can use those. Or you may need to get in touch with an occupational therapist to organise some equipment to help with your mobility so you can get to the toilet in time, which can be the reason why you're incontinent anyway, is not getting there. So a referral to an occupational therapist by your GP or the physiotherapist or any other professional that's working with you. Get that equipment organised so that you can get to the toilet in time and you've got the confidence to go out and use the public toilets. Okay.
Another big question, Janet, is how people can get product and possibly get help paying for it too.
Yes, this is often people have no idea where to get them from. Luckily nowadays the supermarkets, pharmacists all stock pads. And there's a big range. The incontinent pads are where the ladies' feminine hygiene products are, and the men's ones are in there as well. So men have to go and look at the feminine hygiene shelf to get the men's pads and the women's pads as well. Make sure you do get pads that are for incontinence, not for periods, because period pads are designed in a different way. They're designed to absorb blood, and they don't absorb urine in the same way. They'll actually leak. So make sure you do get a proper incontinence pad. Now, they have limited choices in the supermarkets and pharmacies because of the lack of shelf space. So they only tend to have the smaller pads with the sticky on the back. The biggest one you can get is sort of this size, which holds about 700 or 800 mils. If you need something bigger, you need to go into the bigger products, which you can't get in the supermarkets. There are disability resource centres or easy living centres dotted throughout the country, and they sell a good range of pads and products, and they do have the bigger ones. So you could go on there and have a look at the products and have a look at them and have a feel of them and see which ones you want to buy. So to get the larger ones, if you need, say, a really big pad, for night time, something that's going to hold a litre, 2 litres. You can buy these directly from the companies who supply them, and they've all got free phone numbers. You can phone them up and ask for some samples so you can try before you buy. If you're wanting to know if you can get free pads on the health service, the problem with these is they won't supply with everything that you need. It's a supplementary service. Sometimes you have to buy extras yourself. Now, to access free pads, you have to have a referral to the Continence Nursing Service in your area. So that's by your GP or another health professional. The criteria for free pads that the Ministry of Health states is you have to leak a minimum of 400 mils a day, or 1 big glass full of urine a day, and or be incontinent with your bowel. So you can't get them if you're only leaking a small amount. So if it's only 100 mils of urine or a couple of small panty liners a day, you won't get free pads on the health service. But always get the referral to the continence nurses anyway, even if you don't fit the criteria for free pads, because we do an assessment. It takes up to an hour to do a full continence assessment, and we will find out what's wrong with you, why you are leaking in the first place, and hopefully fix that problem. So you may not actually need a pad. Pads are the last resort when we've tried everything else. We can put you on a bladder retraining program, look at your fluids, sort out constipation, and you may need to be doing, well, you will need to be doing pelvic floor exercises. We can also do a scan on your bladder, a portable ultrasound scan, to see if you're emptying your bladder properly. So we need to see you anyway, whether or not you're going to get pads or not. It's really important you do get that. Now, to pay for them, if you do have to buy some yourself, you can apply for the disability allowance, and I can send you out a little booklet on that. Now, the disability allowance is money paid to somebody who has got a disability and would be eligible for a community services card, because it is means tested. So if you are eligible for a community services card, you can apply for the disability allowance. And being incontinent and needing to buy pads is one of the criteria for getting one. So please get one of these, because even if you're only using a very small pad, a tiny pad, if you're having to buy 20 or 30 a week, it adds up, and it can be a lot of money if you're just on a pension. So please apply for that, and you can do that via your GP, or we can send you out a form to help. Okay.
What are the best products for overnight, particularly for quite heavy incontinence?
Yeah, this is a big problem, because one of the things that happens as we age is our kidneys produce more urine at night than in the day. And this can be a problem. People are often going normal in the day, then they're up 5-6 times every night, and they're passing large amounts of urine, and they don't know where it's all coming from. But it's what pools in the day comes out at night as we get older. So it is common to need some people are fine with a little pad in the day, but at night time, when they're passing a lot of urine, they might need something as big as this, or even one of the very large wraparound nappies that are like a children's nappy, but these are for adults. And these can hold up to way over 3 litres of urine, which some very large men, especially if your ankles and legs swell in the day, all that fluid comes out at night. Some people do need the huge wraparound nappy for night time. So there are various shapes and styles and different absorbences. So we will do an assessment as continence nurses to find the right product for you, and that's the smallest pad that will manage your leakage so we don't want you putting in a great big bulky pad if it's not necessary. And there's also, for men as well, there's also something called a uretip system, and this is it. This is the actual uretip. It's sometimes called a uridome, or an external catheter, or a sheath. It rolls on the penis like a condom. It's self-adhesive. It sticks on really well, and then you attach one of the catheter bags to it, and that will drain the urine at night. And there's also another bag you can put on the bottom which holds up to 2 litres of urine for people who pass larger than 500 or 700 mils at night. So these are very useful for men who don't want to wear a pad. Some men think it's a woman's thing to wear a pad, and they'd rather wear something like that that's just for men. So there is that option as well, but you have to be taught how to apply it by a nurse, how to put it on and look after it and care for the skin. So the continence nurses will will talk to you. They'll give you samples of pads to find out which one you need for day and which one you need for night. Now, most DHBs will give you 1 or 2 pads for the day and 1 pad for the night. So 2 to 3. If you've got a lot of disabilities and are completely incontinent and can't use the toilet, then you can get up to 4 pads a day on the health service. But again, each individual DHB is slightly different as to what you get. Okay, so the other thing we've got as well, which is very useful for night time, it's a bit big to pull this out, but this is a washable bed pad. It's padded on top and it's waterproof underneath. It's 1 metre square, and you put it on your bed, and the patient actually lies on top of that pad, and that will absorb up to 2 litres of urine. So if you've got a pad on that's too small and it's leaking, get one of these. They're about $50 or $60. You can get them off our website, and all the companies produce them, and it can save you having to strip and wash the bed every day, and they're really, really good value. One of those will last about 350 washes and tumble dries, so get one of those to protect your bed, and it'll also absorb any extra leakage, so you're not having to strip everything off and ending up with a wet mattress, which can happen at night. Now, the other pads that are available are pull-ups. These are very popular because they're very easy to use. They were designed initially just for daytime use because they were a slightly small absorbency, but they do absorb a lot more now. So some people find they are good enough for night time, but often they're not. Now, not all DHBs will let you have these for night, but you may be able to get them for the day, but there's strict criteria who can get the pull-ups. They're reserved for people who have, say, had a stroke and only got the use of one arm, somebody with dementia who may not recognise what a pad, one of the other pads are, but they'll wear this because it looks like underpants, or somebody with sensory disabilities or autism who may prefer a pad because it feels better for them than having on the nappy or the 2-piece system. So you will be assessed as to whether you can have these or not, but they are available free on the health service.
Also, Janet, people concerned about the environment, tell us about washable products.
Yes, a lot of people ask about that because the products have a waterproof backing on. This apparently can take up to 900 to 1,000 years to biodegrade. The inside, the fluffy bit with the incontinence on it, that biodegrades pretty quickly, but this outer covering doesn't. So with worries about the environment and the landfill, lots of companies all around the world are making some really good washable products. They're cotton and lycra. The pad is already stitched into the pant. So once you've wet that, you just take that off, put a clean pair on, and chuck these in the washing machine. They're all machine washable, but they're not tumble dryable because of the elastane in them. Now, they come in a whole range of shapes and sizes. This is a large ladies. They also come in white, black and white. This is one with boy legs for men, but a lot of ladies like the boy leg because they find it more comfortable. Again, the pad is stitched in there. With this one, you can actually buy some extra pads that are washable to slot in as well. So when you've wet this, you have a little liner and you just wet the liner, throw that one away and put a clean liner in, and then that keeps this pad dry. So they're really good if you're going out for a long period and you can just keep changing the pad instead of having to go to the toilet and take your clothes off to get the pad off. So that's really handy. They also do boxer short style for men. It's got a little access part here. So again, the same thing. This is a slightly different pad. The padding is thinner, but it's stretched throughout the whole of the pant. And this works on an evaporation method. The heat of the body evaporates the water out, but it traps all the salts and the other bits and things that are in the urine. So some people find these a bit more comfortable than the one with the solid pad. But some ladies like the feel of the pad because they feel more secure with something a little bit more bulky between the legs. The other one, they also do them in a lingerie style for younger women, or if you want to go out and put a nice dress on and wear something nicer. These are the same. They've got the pad which acts on the evaporation system, but you pay more for the lingerie ones because these are actually made from bamboo and lace. They're also working on a G-string kind for ladies who want to wear the tight white ski pants and they've got leakage problems. For young women, they can get G-string shaped incontinence pads. But these are really good. They're available on our website. A lot of companies make them nowadays. If you Google washable pants, there's a whole heap of them. Not all of them are available in this country, but we do have a very good range. And we do have some little Plain basic white ones on our website you can buy. They work out at $5 a pair, 5 in a pack of 25, and they're really good as well. They're just a basic white pant. Now, the problem is with the washable products, they don't hold a huge amount of capacity of urine, just up to sort of 350 to 400 mils of urine. So they're good if you're just going to leak a large mugful, but you might have to change them quite frequently throughout the day. Now, you can get these free on the health service instead of the disposable pads. And the government will allow you up to 6 pairs a year. So 6 pairs, you can wash and wear them, and they will last you a year. So you can just buy some extras yourself, which you can use your disability allowance for. So you've got plenty of them. So they are a really good option for people with light to moderate incontinence or fecal smearing, but they're not adequate for people with large incontinence where they're going to be leaking 500 to 1,000 litres, 1,000 millilitres. You'll need something bigger and more absorbent. But they are a really good option, and they're becoming more and more popular, especially for women.
What about caring for skin and avoiding infection?
Yes, it's really important with incontinence that you keep the skin clean. And you can just have a bath or a shower or a bed bath every day. But there are products on the market. There are cleansing foams and cleansing wipes, which are specially designed for the skin of incontinent people because it maintains that pH value of the skin. So you're not going to be prone to getting thrush and skin infections. And it's very important that the pad is a large enough absorbency to absorb the amount of urine you're leaking. Because if you're wearing a smaller pad and it's filling up and flooding and your skin is staying wet, then you're at risk of getting maceration of the skin, and then you can have an infection. So it's important your pad is good enough for you. So it's very unusual to see nappy rash nowadays. I've seen it about twice in the last 10 years because the pads are so good. The modern day pads are brilliant. They're full of super fillers, these tiny little curly fibres which swell up and absorb huge amounts of fluid. And so they wick the urine away from the skin and the pad stays dry to touch. But if it's flooded, if it's too small, it won't work. So you might need to go up a bigger size to protect that skin and stop it getting moist. Also very important that you change the pad often enough. With the slip-in pads, it's got a little anti-leak. It's got a little, it tells you how full the nappy is. So when it gets 3/4 full, when that goes blurry, it's time to change the pad. So all of these have got one of these wetness indicators on. So that will give you a tip on when to know. Check the wetness indicator. When it's 3/4 full, change the pad. The pad shouldn't be left on for longer than about 8 hours because of all the bacteria and viruses that will grow on the surface of the pad, and we don't want you to be getting urine infections or skin infections from that. And also make sure you put the pad on from front to back. So when you apply it, push it from front to back, and when you take it off up the back. So you're not pulling bacteria and viruses from the anus towards the urethra and your bladder, which is when you could get a urine infection. So how you put it on and take it off is very important to prevent infection. But the continence nurse will go through all that with you, how to apply them carefully and take them off as well. Okay.
What are your general, I know you have plenty of these everyday tips for managing incontinence?
Yep. Oh, there's lots of things you can do to help. And a lot of these things are conservative measures, but they can prevent you needing to wear a pad and may even prevent you needing surgery, because these help manage the bowel and the bladder. And so one of the most important things is fluids. Most people don't drink enough. Now, there's a lot of misinformation out there about how much water you should drink. A lot of people think you need 8 glasses of water a day, plus your teas and coffees and everything else as well. But that's incorrect. It's actually 8 glasses of anything. So that's tea, coffee, water, juice, anything else that you're having is all included in those 8 drinks a day. We get lots of referrals where people have got an overactive bladder, they're rushing to the toilet all the time and they don't know why. When you ask them what they're drinking, they're having 10 and 12 mugs of coffee a day. And I actually had somebody who was having 8 litres of fluid a day because she got the 8 and thought it was 8 litres, not 8 drinks. So the problem was fixed over with a phone call. So you've got to get the fluids right. We need between 1.5 to 2 litres of all fluid together every day. We do get fluid from food as well, around 500 mils. So that's important. Now, the type of fluid is really important as well. You don't just have to drink water. You can have tea, coffee, juice, milk, whatever you like, but drinks with caffeine in can irritate the bladder and cause some overactivity. So that's your tea, coffee, Milo, chocolate, and any of those energy drinks have caffeine in. So if you've got a dicky bladder or an overactive bladder, stop the caffeine. That's really important to do that. And that can actually help regulate your bladder, stop you running to the toilet too often. You can get decaffeinated, good quality coffee nowadays, and all the major tea brands do decaf. But watch herbal teas. I've had a lot of referrals with people who've gone on to drinking green tea. Green tea's actually got caffeine in as well. And a lot of the herbal teas are made with black tea, which has got the caffeine in. So make sure you check the box, check the label that it says decaffeinated on the box. Then you know you're not getting caffeine. Avoid fizzy drinks, especially for children. This can cause problems with the bladder. And alcohol is a diuretic. It stimulates the kidneys to produce more urine. So if you're going to drink later in the day, especially after dinner at night, you will find yourself getting up at night more because you're producing more urine. So you need to look at how much alcohol you're having towards the end of the day. You might need to start drinking a bit earlier in the day to prevent you getting up at night. Regular time voiding. A lot of people go to the toilet far too often. They get that first little urge to go and they go to the toilet just in case. And you can actually give yourself what we call a just in case bladder. And you end up going every hour, day and night. Some people end up going every 30 minutes. They've trained themselves to do that because the bladder is just a muscular bag that goes up and down with the urine. And like any muscle, if you don't use it, you lose it. So if you keep emptying it and emptying it, it'll get smaller and smaller and it can become stiffer. So you physically can't hold any more urine. And then you've set yourself up with what we call a just in case bladder. You'll have an overactive bladder and you'll be having to go far too often. You should be going to the toilet and to empty your bladder about 7 or 8 times in a 24-hour period. But I've had patients who are going 20 to 30 times in a day because they've trained themselves to do that, or they're drinking too much. So keep a little record of how often you go. You should only ideally go every 3 to 4 hours. 2 hours is all some elderly people can hold on to because the bladder does get stiffer as we age. But if you're going any less than 2 hours, you've got a problem. You need to see the continence nurse and we can put you on a bladder retraining program. Prevent constipation, because constipation can trigger off bladder spasms. If you've got hard lumps of feces next to the bladder, it can trigger off bladder spasms and make you go more often. And it can actually stop you fully emptying your bladder if the constipated stool is very, very hard. And it can also cause urine infections as well. So very important you get your bowel working, that you're passing a nice soft motion every day. That's soft and smooth like a snake. It's not hard and knobbly or cracked or dry. Getting the bowel right often sorts the bladder out as well. And losing weight. We're getting an increase in obesity-related incontinence worldwide, especially with younger women. So if you've got a lot of weight on your tummy, that will press on the bladder. So when you bend forwards or stand up or cough, you can leak urine because the weight is squashing the bladder. So very important to get rid of that tummy weight if you've got a problem with your bladder. And that often might be all you need to do is to lose some weight. And then pelvic floor exercises, they are the most important thing you can do. We have ones for men and women. We also teach older children as well. Every woman who's had a baby needs to do pelvic floor exercises for the rest of your life. If you've had surgery on your bladder or your vaginal area, or men who've had prostate surgery, you need to do these exercises every day. Now, we're all told about them when we had a baby, but of course you're all wrapped up in the baby and everything else that's going on. They get left behind. You should do 10 squeezes each time, 3 times a day, every day for the rest of your life. Now, they're easy to do. We can send you out a leaflet and we can teach you how to do them properly. But to remind yourself to do them, use post-it notes, stick them on the dashboard in the car, put them in the bathroom in the morning for when you're cleaning your teeth or in the bath. Attach it to something you do. If you have 3 meals a day, do your exercises every time you have the 3 meals. But most people are in the car every day. So do them when you're driving around in the car. But you must do them every day. Like any muscle, if you don't use it, you lose it. If you leave them for 3-4 months, you've got to start again from scratch. And it can take up to 3 months to get that muscle big, and strong. So you can do the exercises. So when you cough, sneeze, bend or leak, you can tighten up those muscles so that you don't leak. And it can give you the time to get to the toilet so that you're not leaking on the way. And also doing the exercises can stop the urgencies that we get, especially at night. So that's another reason to do them. So important for men and women and older children. But also keep fit generally. The pelvic floor muscles also comprise the abdominal muscles. There's all of the muscles around the pelvic area. So keeping yourself fit generally can help prevent incontinence in many ways. But don't overdo the exercises that could damage the pelvic floor muscles. So if you're going to the gym and you've had a baby, you need to talk to that the pelvic floor, trainer, and say to him, can you teach me how to do pelvic floor safe exercises? Because a lot of young women are getting incontinence because they're going to the gym, they're doing heavy squat thrusts, and that kind of weight will damage your pelvic floor, especially if it's already damaged through giving birth. Or you may have a prolapse, you may have a vaginal prolapse after giving birth and not know. So it's very important you're taught how to do exercise safely once you've had a baby. We actually run courses to teach the personal trainers how to teach women who've got a damaged pelvic floor how to keep their pelvic floor safe. And we've got leaflets on that and you can have a look at as well. So general fitness is as important as the pelvic floor exercises. And then looking at your fluids, your bowels, toileting regularly, not going too often. All these are the things that we teach as continence nurses, and a lot of this will actually fix your incontinence. You might not need anything else. You might not need surgery even. So really important to get that referral to the continence nurse. Okay.
So as you can see, Janet is an absolute wealth of knowledge. And if you'd like to talk to her in person, you can, because she answers our phone lines on Mondays and Tuesdays and on Wednesday morning. And that's our helpline, 0800 650 659. Thank you so much, Janet.
Yeah, no problems. That's my pleasure.